MCN Channel
Welcome
6.
to Acumen Business Spotlight. I'm Mike Colosimo, and today I'm joined by Dr. Jamy Antoine, owner of the Minnesota Disc Institute. Yes. Dr. Antoine, how are you today?
Doing very good, thank you.
Terrific. Folks that have serious neck injuries, tingling in their legs and their arms, really want to hear what you have to say today.
Yes.
Let's talk about some of the patients that you see.
Absolutely. The very specific type of patient that we see are patients that have been a lot of places actually. They've been to traditional chiropractors, they've been to physical therapists, most have had epidurals, even a small percent have actually had surgery. For severe issues like severe pain in the neck or back, numbness, tingling, weakness, very chronic conditions, those are the very typical patients that we see.
Great. And the type of care you provide is very specific. Can you talk about that?
It is. It is called the NSD method of care. It's actually a trademark program that was developed by a doctor in Michigan. And long story short, this program actually helps the disc heal. And that's why a lot of therapies out there really don't work long term, is because they're basically pain management tools. They're not really helping a disc heal. So very typically, patients will have bouts and episodes of pain for many decades actually, is very common, where sometimes they'll have severe pain, sometimes they won't. They'll get medication, they'll get shots or what have you, and some of those therapies can help temporarily, but they have a very short shelf life, meaning that they are only helping with the pain. They're actually not helping the disc itself heal. So those therapies will eventually fail, and that's where we see people coming into our office after trying many, many things, lots of time, lots of money spent, and really no success. And that's why our program has such a high success rate, actually over 95%,
wow,
because we're actually getting the disc tissue itself to heal.
The 95% success rate is very impressive.
Yes.
What if someone is talking about surgery or may have had surgery? Can you assist with them as well?
A lot of times patients come to our office after already having surgery, probably 25 to 30% of our patients. Even if they've had a discectomy or a laminectomy or certain other surgeries, they certainly can still be a candidate. If they've had a fusion surgery, unfortunately that would actually make them not a candidate. A lot of times also, our office is the last place that people will go before they're going to head to surgery. They've already been told by their medical doctor, hey, you need surgery because of the numbness that you have. Many cases actually, people do not need surgery. All they need is for the disc to heal, and that will take care of the condition, which is the herniated disc or the bulging disc, and that will of course take care of the symptom as well.
Okay. And you yourself have had some issues over the years. Can you talk a little bit about that?
Absolutely. Several years ago, I actually had an MRI of my neck because I was having severe pain, weakness. I was actually having a little numbness and tingling in my hands. And basically what was happening with me, as you can see on my MRI, is I had 6 bulging and herniated discs. Now, if anyone should have had a healthy spine, it should have been me. I was getting chiropractic care for 15 years, doing all sorts of rehab, exercise. I worked out a lot, eat really, really well. So I should have had the perfect spine. And that's actually the perfect example of how those therapies that I tried and a lot of my patients try are great tools, and they're not wrong. They're just the wrong tool for a disc issue. And for myself, as you can see right here, what was happening, I had severe disc issues putting pressure on my nerve. That was causing my issue, my numbness, my pain. And the NSD method really has helped my discs heal. And that's really why I'm so passionate about what I do. We see people just like myself that have tried a lot of things, get no results. And getting the disc tissue itself to heal, it really helps a lot of patients.
Right. It sounds like it helps short-term and long-term. It's not just a short-term remedy, it's a long-term solution.
Exactly. It's just like any tissue that is damaged. If you cut your wrist, you break your leg, you do whatever you do, as long as you give those tissues what they need to heal, they will heal.
Terrific.
Same concept with the disc. We give the disc what it needs, it's going to be healthy.
Great. If you'd like to get in touch with Dr. Antoine, you can contact him at area code 952-567-2379 or visit him on the web at minnesotadiscinstitute.com. When we come back, we're going to talk to Tim Jopp, president of Legacy Benefit Consultants.